Hi, everyone. Welcome to the conference session titled Holistic Expert Care Panel. Thank you for joining us. I'm Lee Clark, Director of Patient Services. As we get started, I'd like to recognize the generous support of our corporate sponsors, Alexion, Apellis, Amgen, BioCrest, Bristol-Myers Squibb, Genentech, Novartis, Regeneron, Servier, and Tahoe Oncology, and the generous support of our patients, families, and caregivers who without everyone's support, this conference would not be happening today. This is going to be an interactive panel, so there will be some presentation, but we're going to try to keep this where everyone's kind of interacting and it's a flow of a conversation. So we'll be taking questions from in the room, we'll be taking questions online. So be ready with your questions. Our experts are here to answer all of your questions today. When asking questions, I do ask that you do a few things. First, if you're in the room, let us use the microphone so we make sure that we can capture your question for those listening online. And then so our experts can answer the question so that can be heard as well. If you're online and you'd like to submit a question, if you look on the right of your engagement panel, there's a Q&A icon. Please click on the icon, type in your question, and hit enter. We'll be flowing through and asking your questions as well. I'd like you to keep in mind to not share private health information in your question. Our expert speakers cannot answer any specific questions related to your personal health care. Our specialists today are Mazie Tsang, Melody Griffith, and Jodi thank you. Dr. Tsang is a hematologist who specializes in the care of lymphoma and leukemia. Her clinical research focuses on the intersection of geriatric hematology and supportive care. She is focused on improving decision-making, patient-reported outcomes, management of older adults with advanced hematological malignancies. Melanie is a licensed master of social work pursuing clinical licensure with a certificate in oncology social work. She provides comprehensive psychosocial assessments and emotional support at the Mayo Clinic, Arizona Cancer Center. Jodi is a patient navigator. As a patient navigator, Jodi helps patients and caregivers through diagnosis, treatment, and beyond. She's an active member of the patient's healthcare team, helping with assessing and addressing immediate needs and laying the groundwork for future and ongoing support for her patients. With that said, I'd like to welcome our panel. Thank you.
So I just wanted to sort of set the background for this panel by sharing an example of a patient that I saw recently. He's a patient of mine with 2 different blood cancers, multiple myeloma and leukemia, and he had a transplant, and this was his 1-year visit when I saw him a couple weeks back. And we were talking about, I have this study where we have patients and caregivers sort of work in a physical activity program, and so he had enrolled on that study, and I was asking him how he felt about it. And what he said was really an eye-opener for me. He's like, when you have cancer or any of the, like even aplastic anemia for that matter, you feel like you're losing control of everything. And so he said, in that sense, exercise, physical activity, gave me some of that control back. And so we wanted to bring this panel to you to show you that there might be a lot of things that you feel you're losing control of as you go through your journey with your MDS or aplastic anemia or PNH, but there are people in our teams that can help you get some semblance of that control back. So with that, I'll just have Dr. Tsang start the discussion. Thanks.
Well, good afternoon, everyone. Thank you so much for the invitation to the organizers, and thank you for that kind introduction as well. So today, I have the honor of being able to present with 2 fabulous colleagues, and I think that, our focus is all about you. And so I want you to write down your questions. You're also welcome to ask questions afterwards if it comes up after today. But we're really focused on the patient experience today. So who are we? I know that we provided a little bit of an introduction at the beginning, but I am a lymphoma specialist primarily. I've been trained in supportive care intervention, so looking at like palliative medicine supportive care to help provide extra level of support to patients. And I also do a lot with older adults, so people who are going through their treatments, transplants, any sort of major life event, and helping them have their values, their goals, and their wishes be honored. So thank you very much. And Jodi, would you like to share a little bit more about what you do?
Sure, thank you. I'm Jodi Chuk. I'm the Cancer Center Patient Navigator here at Mayo Clinic. So I work with any patient that is coming to our cancer center for care. Main focus is to break down barriers to care. So barriers could be really anything that might impede you coming to appointments, possibly cause stressors like financial toxicity can be a major stressor during this time. So really just meeting with the patient, finding out where they are in that moment, and trying to break down those barriers. I do partner quite frequently, actually usually daily, with Melody and her colleagues in social work because we work really closely together. A lot of the work that we do interchanges. You know, we cross barriers a lot of times together, so we work very closely together. Thank you.
And I'm Melody. I'm one of the outpatient oncology social workers. I also work with people who have benign hematological disorders, so not just cancer, other things as well. And like Jodi said, we partner to make sure that you have what you need throughout your treatment journey or diagnosis or survivorship, whatever you'd like to define it as. Social work does focus on the emotional needs and provides care. And here at Mayo Clinic, we are fortunate that it is not an added cost or insurance bill to work with social work for counseling or for support. We just view it as part of the team, and that's what we'll be talking about here is how we work together as a team, and wherever you get your treatment or see your doctor, hopefully there's some team members, and this presentation might give you some things to talk about with them. So just as Dr. Kira mentioned, you might feel like you have a little bit more control over certain situations, and that you can really feel supported through anything that you're going through now or in the future.
And so today, for this panel, we're going to first define what is holistic care. We're going to provide an overview of survivorship care, and we're going to describe further the roles of social work and patient navigation. Then we'll discuss the most common issues that many patients have questions about, and then we'll open the floor for discussion about your questions and things that you'd like to know more about. So first, what is holistic care? It's treatment of the whole person. And really, when we're thinking about the whole person, we're thinking about everything about that person. So not just the physical component, but what this diagnosis means for you emotionally, how it affects you, your family, your loved ones, anyone that you interact with, people at work, and spiritual needs as well, because oftentimes a diagnosis can bring on more existential, bigger questions about why and what all this means. And as Melody had mentioned, there are also additional mental and social factors. So thinking, cognitively, like what all this can mean, it can be a huge burden, mentally. And so we are here to help as a team to support you further. So when we say multidisciplinary team, that means many different individuals involved, more than just what you see here in the panel. And we'll talk about that further. So it really does take a team to go far together. And you, as a patient, are the center of the team. You are the quarterback. We are here for you. We're here to protect you. We're here to be able to support your values. So this is a list of just some of the people who are here to support you as a patient. As you can see, oftentimes when people think about their medical care, they focus on their relationship with the doctor, but it's more than that. We have a very, very large team, and that goes beyond the scope of everyone that's listed here. Now, this is exactly why we need holistic care. So this image here shows the whole person. And understanding the whole person means that, we have to think about how your life going back to work after a transplant would look like. What about you as a parent or a caregiver or loved one? What is that going to look like? And so when we think about a lot of the issues that happen after a transplant, we think about some of these here that are listed. And as you can see, not all of them are specifically only medically related to whatever the medical diagnosis is that led to a transplant. It really is the whole person that we're treating. And so some of you may be familiar with a survivorship care plan. This is an example that you see here that you might have received about what medical conditions you might experience after a transplant, what are some of the things you have to do so that your primary care doctor or provider can have some guidance. But this is only just one part of it, right? There's a lot more to it. And so the current medical paradigm is that we're going to give you a survivorship care plan and we'll release you to your primary care doctor, and that's the rest of the follow-up. And that can be anxiety-provoking to a lot of people because there's just so much about having gone through that transplant. It's a major life event, and what we are proposing is this holistic care model rather than just focusing on the medical model. And so we here at Mayo Clinic are really striving to do both. So I'd like to invite Jodi and Melody to speak a little bit more about how we can better support you.
Thank you, Dr. Tsang and Dr. Kira and the Foundation for giving us this opportunity to talk to you. So as Dr. Tsang said, there are lots of different people on the multidisciplinary team. We just represent 2 of those areas that may or may not be represented where you are. But our goal is to talk about a little bit about what we do, but also what might be available to you in other ways wherever you receive treatment or talk with your doctor. So my role as a social worker, first of all, most social workers in any medical setting do have a master's level of education and are licensed within the state. Sometimes it's clinically licensed, and sometimes it's just licensed at the master's level. We do provide emotional support, and that is a very broad term. We are aware of that. Your emotional support might look different than the person sitting next to you, and that's okay. It's our job to help understand what your needs are and see where you're at, and the level of involvement really depends on our patients and what they might need and what they feel like they would benefit from. Some of that is one-on-one counseling. We can call it counseling or therapy. It is brief, so it won't involve typically, if there's other things going on in your life, it would be more surrounding your diagnosis and your treatment and what you might need to get through those things successfully and how you can cope, perhaps in a healthier or more beneficial way to you. We do offer family support as well, and we'll talk about caregiver support a little bit later. And social work often does support groups that are specific sometimes to diagnosis and sometimes just like coping education and tools that might be available to anybody with any kind of a chronic or acute health condition.
So as a patient navigator, I work really closely with Melody, like I was saying before, and her colleagues to provide all of the support that we can possibly provide a patient. At Mayo Clinic, I'm a non-clinical patient navigator, but this may look different in your healthcare center if you're being treated elsewhere. Navigator is kind of general term. Here at Mayo Clinic, we have several different types of navigators. We have a patient navigator, which would be myself, and there's nurse navigators who are sort of involved in the intake process, where they check records for patients, make sure that we have everything we need here at Mayo Clinic. So we all sort of work really closely together as the care team, but we all do kind of just a little bit different thing for the patient. But so again, that could look different wherever you are, seeking treatment. Two main focuses for me, just because I'm at Mayo Clinic and we do treat a lot of patients that are outside of this area, are transportation and lodging. And that could look different for each patient. I like to meet with patients and really get a good picture of where they're from, what they're looking for, if they're maybe having family members coming with them, if they're in a specific type of treatment that would require them to stay nearby, and those types of things. Gather information and then share specific resources for these two, lodging and transportation. It is really important that the patient have access to both of these resources, because obviously if they do not, they might not be able to have treatment where they choose to have treatment. Navigating the healthcare system and appointments, a lot of that is, we have a lot of elderly patients that come to Mayo Clinic and they don't have support with them. So if I meet the patient where they are at in the moment and try to provide specialized service for any patient that I am working with. If that means I go to the front door and meet them and escort them to their patients in different buildings here, then that's what I do. So I really just try to tailor my services on each individual patient.
And so since we work closely together, and I find that a lot of times roles overlap when you're working as a team, and especially when you have the same goal in mind of taking care of a person as a whole person. So something that both social work and patient navigation do is we really try to curtail a list of resources that are pertinent to each individual person, and depending on what your needs might be. We both help with financial assistance. There's various foundations that may be able to provide support depending sometimes on your diagnosis, sometimes on your treatment. But you might be well aware of what's available out there, but it's always good to ask someone wherever you are seeing your doctor or getting treatment, so there might be something that you're just not aware of, or something they could help you apply for and take that burden off of your shoulders. Coordination of care, I think, is also a general term. We fill in the gaps where we need to. Sometimes it's being in a clinic visit with you and the doctor, so that we can make sure everybody's on the same page, and just kind of filling in those gaps. Patient advocacy, I think, goes hand in hand with that as well. So if there was ever something that perhaps you maybe felt uncomfortable talking to your doctor about, sometimes we've helped have those conversations or brought those things to the provider's attention. So yay, health insurance. It is so important, and I am certain that I don't need to explain to you the need to have continued health insurance, especially when you have a history of a health condition that does require pretty specific treatments or changing treatments over the years. So the things that I put together here is important questions for you to ask yourself if you are in a situation where you might be choosing new insurance or aging into Medicare. I first will point out, I steal this from my dad every year. This is what I call the Medicare Bible. It's available online too. He just got his 2024, but I didn't get to steal it yet. But this is a good resource for anything that you might have. It does not list specific medications, but anything about home health or devices that you might need, or hospital or outpatient services, and a little bit about medication coverage, just not specific medicines. This is a huge resource. This being said, not everyone has Medicare, but what my point is, try to be familiar with your insurance plan and what it covers, and be familiar with words. You can even look up, what terms should I know about my insurance? Co-pays, deductibles, out-of-pocket maximums. monthly premiums, those are all things that you should ask yourself when you're looking at different insurance plans. And I would say for this specific audience and for most of the patients I work with, it's very important to know and understand your treatment plan, because if you are on a medication, let's be honest, even with insurance coverage, sometimes it is a very high copay. And that really can be a big barrier to getting the care that you need or that your doctor wants you to have. So having a conversation perhaps with an insurance before you even choose them, because they can and will give you information about, okay, I'm on this medication, what would that coverage look like, so that you can make an informed decision. It's also important, if you have a good relationship with a team and you're going to be changing insurance, to make sure that that insurance is still accepted where you're getting care. Otherwise, you might have to switch treatment providers, and that can be really difficult too when you've established rapport with someone already. We don't want to lose you all, and we know you probably don't want to lose your teams either. So those are good things that sometimes people see, oh, this has better drug coverage, but now I can't see my doctor that I've seen for the past 5 years, and that can be really difficult too. So keeping in mind all of those things, there are insurance brokers that do not charge. You can find those on the internet. Their job is to help you ask those questions or ask those questions for you. There's also the Area Agency on Aging. Every state has access to that. We have one here in Arizona. They actually have, when you call, it's an automated system, and it's like, if you have questions about insurance, push 2. And you could get more information from somebody who can speak a little bit more to those insurance plans. Again, with medications, you might want to ask your provider, hey, if this copay is too expensive, is there another medication that does the same thing? The answer might be yes, and it might not be yes, but we can always potentially seek some assistance for you to help you get the medications that are best for your plan.
And I just wanted to add just really quickly, I use personally Triage Cancer. I throw this name out there wherever I have the chance to, because it's such a great organization. So when I'm talking to patients, I often will share their pamphlet or their website information, because Triage Cancer is a great spot to look for information. They also have like workshops and things like that you could attend.
For free.
For free, yes. And they're just really informative about things like insurance, legal matters.
And I will point out, cancer is in their title, but they help
Yes.
with a lot of other things too.
Yep.
So don't shy away just because cancer's and some of the resources we share later, they do have cancer in the title, but they help a broad range of acute or chronic illnesses as well. And it's just a good information base.
Yeah. So finances and work. So we realize, and everyone on your care team realizes, that a diagnosis of any sort will cause a lot of stress, changes in life plans, and it will cause many different disruptions in the way that you're living your daily life. So financial toxicity is really just the factors that cause the stress and whatnot. And finances is a big part of the stressor of having a diagnosis.
And I would just equate it to, just like a medication might have a side effect or things that are adverse, but we still use it because we need it. We know that you still need these treatments and you need insurance, but there is a financial, I don't know if downside is the right word, but there still is a consequence, a financial consequence of treatments and services and getting where you need to be and everything. So we kind of view those as similar, as there are physical toxicities to perhaps getting treatment or not getting treatment, but then there's also the financial burden of that as well. And that's what's been coined as financial toxicity.
Sure. And we also realize that when you're having these conversations with myself or Melody or anybody on your care team, it's an uncomfortable conversation to have, right? No one usually wants to talk about their finances or the things that are burdening them. So just know that your healthcare workers, we realize that this is a very common situation, and we do our best to try to offer some information that will be maybe reduce the burden of that stress and whatnot that goes along with that. I always tell people to make sure they have someone that they trust. Go through like bills and any kind of financial dissection, I guess. If there's somebody that you trust that can do that with you, that's really helpful to take some of the stress off of yourself when you're going through treatments and things like that. Time off of work is one of them, of course, right? Because a lot of times with the diagnosis, you have to count on having some time off, whether that be for appointments or treatments, things like that. So it's really good to connect with someone in your HR department, for example, if you are working, to get a good idea of what that may look like if you take time off of work, how much time you could take off of work. Considering maybe short-term disability or long-term disability or both of those things. FMLA is another consideration. Each employer is different in what they offer, so it would be best for you to go directly to someone in your HR department to discuss those types of things. Financial responsibilities really can be anything, right? It can be maybe you have children at home, maybe you you have bills, right? You have your mortgage, you have all of those things that are daily things that aren't an issue if you're not in treatment. So those things can be big stressors in your life when you're going through something like this. Career changes, that could mean you speak with your employer and you come up with maybe a plan of changing your hours, maybe changing what type of job you can do based on your diagnosis or treatment and the side effects to that. But those might all be possibilities. So they're all things that are good to review. And the change in role, again, that could just mean that you're put in a different job role for the time being. But those are all great questions to go to with your employer.
And to career changes could even be, I've decided that with this medical diagnosis, I want to change what I'm doing in my career. I want to have a totally different career path or retirement plan. All of those things may come up, and that is something that you should and can consider. And it is good to talk to your provider and the rest of your team about those things and the plans that are important to you, so that we're aware of how can we tailor treatment and appointments to best meet your goals and help you achieve them best you can with our support. And change in role too could even be, maybe you were the primary breadwinner of the household and you've had to cut back on hours, or you've had to retire early, or you've not been able to take that job that you wanted to take. That could look different too, and we know that that has an impact not only on finances and just you as a person and as a employer or an employee, but it also can take a toll on relationships and family systems as well.
So going back to lodging and transportation being a big barrier for some patients in treatment, we talk about things such as availability of your friends and family. Do you have neighbors? Do you have people that can help get you here when you can't drive yourself? Community resources, we call on this a lot here at Mayo Clinic in my role. There are a lot of resources in our area. Thankfully, we're in Phoenix, so we're in a large city, so we're able to call on a lot of different resources. That may not be the case, but the point is to try and connect with those people in your healthcare center that may be able to share with you what your community resources are in particular to both transportation and lodging. Financial means can be a huge burden for transportation and lodging. If you're expected to be near your healthcare center for an extended period of time, that can be a huge financial burden for people who have to stay somewhere, have to find a home, or just a hotel even can be very expensive. In our Phoenix area, just for example, we have different events that come up throughout the year that cause major issues with patients just to even locate somewhere to stay, let alone the price of staying somewhere. We have, the golf outings and things like that that really affect patients being able to come here for treatment sometimes. Grants, there are grants available, actually. Melody and I have been working on those together because we realize how important it is to our patients that we find these resources for them. So there are some outside organizations that will offer grants for transportation and lodging, and we take it upon ourselves to do the paperwork and to apply for those grants because they are so incredibly helpful to patients. Anything you want to add to that? No?
Just ask.
Yeah,
You don't know
just
what's
ask.
available if you don't ask. And the answer might be no. We hate having to say no, but we would
Sure.
much rather explore any and every option that might be available to somebody than to find out that somebody was suffering financially or just very stressed about finding these things, and we maybe could have helped a little bit, even just ease that burden of the stress. So please ask. You know, there's no gold stars given for doing it on your own. You have a team wherever you are, and maybe that team is just the doctor and the nurse, but still ask and find what's available to you wherever you're getting treatment and wherever you see your doctor. And
Sure.
accessibility too,
Sure.
we just put that on there as like,
Yeah.
you know, if you need any kind of an accommodation to be able to get somewhere, that is something to consider as well, and just your responsibilities at home. So if you were coming to another cancer center away from your home or treatment center away from your home for several months, you know, for like a stem cell transplant, if you your responsibilities at home don't go away. We know that you might have kids or you might have pets or job, yard work, all of those things. So those are things that you can take into account and talk about with your care team so that we're paying attention to those things that are important to you as well.
Sure, yeah, great.
So this is, I think, the responsibility of everybody on your care team, but I would say, you know, social work does have special training and background in emotional care of people. Some people, when I bring up emotional care, it's like, ooh, let's not talk about that, it's very uncomfortable. And yes, it can be, but I think that it is very important. And as we're looking at you as a whole person, we can't separate the two. There's physical, emotional, spiritual, financial, it's all you. Just like the slide Dr. Tsang showed earlier with all of the parts that make you who you are. So being told you have fill in the blank, whether it is some chronic illness, whether it's a cancer diagnosis, whether it's diabetes, that is huge. And we know that that holds a heavy burden for pretty much anyone. The shock of being told something like that, and then maybe it's not as intense as until you find out what the treatment may or may not be, or the ambiguity that's associated with it. Living with uncertainty is really hard. I know I don't need to tell anybody that here in this room. I think the world got a taste of that with COVID, as far as not knowing what to do or what to expect and how to get through hard times. And it's real uncomfortable. But your team knows that it's uncomfortable, and sometimes we might be pragmatic and saying, we know how to do this and we can treat that, and the stuff that's ambiguous is like, good luck. But ask for support. It is a normal part of who you are. I would say a good 80% of when I'm counseling with people is reminding them that they're normal and that they are humans and not robots. And we expect you to have emotions tied to what's going on with you physically. The treatment that you're having could definitely have an impact on your emotional care. So the frequency, the duration, the type, is it an oral medication? Is it infused? Do you need a transplant? Are we watching and waiting? All of those things have an effect on you emotionally as well. A presentation I went to many years ago talked about how many emotions can exist in the same place. So you can feel hopeful and you can feel scared at the same time, and that's real weird for our brains and our hearts to understand. Okay, just making sure it was still going. It's real weird for those to exist in the same space, and it can feel very conflicting. So those are heavy things to try and manage by yourself. So if you are comfortable talking to somebody wherever you get your treatment or see your doctor, I highly encourage that. There are counselors in the community. Through COVID, we learned there's lots of places do telehealth now for counseling. There's apps for it. So it's more accessible than ever now for you to receive some help. And a lot of therapists and counselors do focus on chronic illnesses and the impact that that has on people emotionally. We know also that it doesn't just have an impact on you, but it has an impact on people that you love and care about and who love and care about you. And sometimes I've had people who I'm counseling with and they said, you know, I'm doing pretty good, but I'm really worried about my wife, or I'm really worried about my adult child. Can you talk to them? And so that's something that we recognize as well. I think caregivers sometimes get swept to the side because we're so focused on taking care of you as the patient, but it's important to take care of your people, or I believe we're not taking good care of you. So for caregiver support, it really depends on where you're at, but there are virtual support groups. Some are disease specific and some are general. So for example, at Mayo, we actually have a virtual caregiver support group that's for any type of caregiver. And that actually meets weekly now and is free. So if anybody ever needs information on that, we can get that for you too. Other places also provide virtual support groups, and there may even be an in-person support group in your area. Also counseling, that one-on-one counseling or therapy. There is paid caregiving. I get this question quite a lot, is, you know, I'm taking care of my mom who has this diagnosis. Can I be paid to be her caregiver? Because it does require a lot of time and energy, and it might take you away from your work even. So there is, depending on where you live, there are programs. Typically, the patient does have to qualify financially and physically. So it can be a difficult process, but that is something that you could ask your care team about, and they should be able to point you in the right direction to at least get information on that process. Jodi touched on Family Medical Leave Act, so that might be something that if you need a transplant caregiver, that someone that you love or that is going to take care of you would take time off of work. Depending on where they work, it typically is federally mandated. If it's a smaller company they work for, they might not have that benefit, but that's not up to you to figure out. You can ask your care team to help sort through some of those things with you. And then including caregivers in family discussions is really important, but especially here at Mayo, and your care teams should absolutely take your preference in mind. So even if you have an adult child who wants to be involved in your care, or a parent who wants to be involved in your care, if you want something to be private between you and your provider, please ask for that, and that is absolutely your right. If you want them to come and be involved, we will absolutely involve them as much as you want, but we respect your wishes as the patient first.
I think too, just to add, frequently I see, like if I see a patient by themselves versus with their caregiver, sometimes the patient will share more or will feel more comfortable. I think that the dynamic between a caregiver and a patient can be really interesting because most of the time those people are very close to each other and don't want to burden the other person with how they're feeling. So that's just something to keep in mind. So we do keep those types of things in mind when we talk to patients and their caregivers.
So I know we've talked a lot about different services and ways that you can empower yourself and ask what's available to you through your care teams. We've listed some resources here, and if you want these sent to you, I'm sure that they can be sent. Some may apply to you and some might not, and that's okay. We tried to give a pretty good sampling here of what might be available, but the first point is to ask a provider, your provider, or a member of your care team. They would be the experts of what's available in your area and specific to your diagnosis, potentially. So we wanted you to feel empowered that you can ask those questions. We know there's a whole lot more to holistic care than just our roles and even just the idea of holistic care, but we wanted to give you a little bit of an idea of things that you might be able to do to advocate for yourself and what might be and hopefully is available in your area. And I think, do you have anything that you want to add? I think we'll open it up for questions. Yeah, Dr. Kira?
I think this was great, and we are hoping for the next 25 minutes to be more of an interactive session, so please start with your questions for the panel. Do you have any online while we wait for folks to think of?
Yes, we have some questions from online. First of all, there was a comment, I'll read that. It says, "I'm so glad that you folks are addressing the stress of finances. Thank you." So I want to make sure we got that out. Our question says, "It's nice to see the Mayo Clinic has such great support programs. the hospital that this person's son is being treated for doesn't offer this type of support for patients. What suggestions do you have about other ways to get these types of services?
I guess I'm going to have to guess that maybe talking about some of these ancillary type supports, because I'm not sure exactly which type of support they're talking about. I would say that asking the provider still if they have any recommendations for community services, but also talking to, if it's for emotional support, I would say talking to a therapist in the community, so it doesn't have to be through the healthcare provider, but that might be a good way to sort through just some of how the person is coping and dealing with those things. Do you have something you wanted to add about resources?
I was just gonna say, sometimes our roles may be presented differently in different healthcare systems. So it may not be a patient navigator, but there may be someone that is comparable to a patient navigator. So I don't know, I'm trying to think of one off the top of my head.
It might even be the nurse, like a
Right,
hospital
sure.
nurse who has a little bit more information or education, or that could ask the questions. Most places have a social worker, at least to some extent. We're all used a little bit differently, but I think that they could connect with resources. I would say, of course, the aplastic anemia, MDS, the International Foundation, that is a wealth of information as well. Same with Leukemia and Lymphoma Society, and yes, some is specific to those types of blood cancers, but they have some general information as well. And especially if it, again, I don't know if this question is about transplant-specific things, but BMT InfoNet has a wealth of information, and the same with Be the Match, in different and similar ways. So finding some of that support online, I think, I wish that it would be in person, and I'm sorry that you haven't found that yet. But I would at least start with those foundations and reach out to experts there and ask the team if they know of anybody that they could be connected to.
Yeah, and if I could just add, sometimes social work will be referred to as like case management or care management. Those can be interchanged as well, so that may be.
Or even discharge planner, if it's at a hospital. So
Sure.
that might be available with just a different title.
Dr. Tsang, any thoughts on that?
Yeah, so I agree with all of the comments. Oftentimes, patient support groups might be able to guide you in sort of anticipating what needs you might have even before you realize you need them. And so I often find, at least as having been in a similar role before, like posting online or telling people in the support group what I'm going through, and then they'll say, oh, you should check this out or look at that. And so that's one way that I've seen people be able to connect with resources. Another way is I would just sort of list in your dream or ideal type of care, what would that look like? And then write it all down. And then maybe your doctor could help connect you with different people who could fill those roles, at least in some way in the community.
Thank you. We do have a couple more questions. Would you like to finish the ones online, or is there a question in the room?
Any question in the room? Okay,
Please, go
let's
ahead.
take one here.
I had a question for the navigator and the social worker. When a patient first comes into the Mayo Clinic setting, would you advise that they just come in and kind of talk to you guys? Because you shared a lot of information that seems very beneficial, and sometimes they might not even know until they actually sit down with you that they could benefit from emotional support, financial support, because they're just so overwhelmed by the disease process itself. So maybe you can kind of talk about that.
Sure, that's very common that people come in overwhelmed and sometimes don't know that we exist. I will say, again, we work really closely together. So if I have someone, I'm kind of strategically placed here at Mayo Clinic for that reason. I'm right by the front door. So, and I'm in the library space, so a lot of patients will just wander in, and that's how sometimes they will find out about me. We also have different ways of referring to and from. Providers will sometimes refer to me, But if I meet a patient, just an example, if a patient comes in to see, just to check out our library, and they run into me, and then I have a conversation with that patient, but something they've said triggers me, or they share with me that, you know, they're really going through a very rough emotional time. They're having a hard time with their diagnosis. I immediately contact the social worker to let them know that this person needs an extra layer of support beyond what I can provide. So yes, we do see patients that way. Melody may see a patient and realizes that this person needs me for the therapy portion, but Jodi has a lot of resources that she might be able to share with her. So she'll let me know, I'm working with this patient, but they really need they're resource heavy, they need a lot of resources. And then both of us are then included in helping the patient. And we do follow up amongst each other. I mean, if Melody isn't here and she has a patient that's going to be in our center, in our clinic, on the day that she's not going to be here, but she's concerned about the patient and she just wants me to check in, I will absolutely do that. I'll check in with the patient, make sure that they have everything that they need, give a report back to Melody, and Melody then will follow up as well. So
I think you hit the nail on the head as far as saying a lot of people, number one, don't know what's available, but also don't know what they need. So a lot of times, all of us as human beings don't know what we don't know until we know it. So there are resources out there that are available, and we do this all day, every day, so we don't expect anybody to be experts on what may or may not be available. So to answer your question, I think anytime you can ask your provider, like first time you're in, or even now if you've been seeing them for years, you can say, who are the members of my care team that I should know about? Do you have a patient navigator? Do you have a social worker or case manager, somebody that I can just touch base with? So that you know, I wish that there was a way that we could see every person who walks in our doors. Unfortunately, our referrals don't work that way. I wish that it was even just like a, hi, this is who we are, and this is what we might be able to offer. And then it really would be up to you to say, you know, I would like to find out a little bit more, or I'm pretty good, but maybe in 2 months from now when I have a question, I know to ask these people on my team. So it's not a perfect system. I don't know that it ever will be, but it certainly is within your control and your right to ask who are the important people on my care team and what might they be able to do as far as these things, or what do I need to know that I don't know so far. And so depending on your provider, some of mine use me as a social worker a lot more than others. So sometimes, unfortunately, I wish it wasn't the case that you had to ask, but that might be the case where you do advocate for yourself and ask to be connected with other people who can provide these other layers of support in addition to your treatment provider.
I'd also like to add, though, that is really important feedback for us to hear, that people are coming in, they're overwhelmed, and they don't know what to ask for. And maybe we could create something if social workers and, you know, patient navigators can't see everyone. Maybe we could create a document to say, here's what we have available, and give it to all our new patients. And that's something that we could work on and maybe even disseminate it more widely. I really appreciate that feedback.
So I would just like to add to that, we do the social determinants of health screen, which asks some of these questions. And as providers, we are supposed to look at that screen and identify if you're having any of those problems like financial strain, difficulty with transportation, or social isolation. And we are supposed to then connect you to the requisite staff that can help you with that. One of the great examples I heard from a patient advocate at an Alliance meeting was, so I work in financial toxicity, that's one of my focuses, and she said, you know, it's such a stigmatizing topic, not everyone wants to talk about it. She said we should have posters in our infusion rooms and our chemotherapy rooms saying financial toxicity is a known side effect of treatment. So please reach out to your care team or such and such member if you need any help with that. So I think as providers, we have to be more proactive about making sure that you are able to connect with appropriate staff for some of those problems. Sorry, I didn't mean to cut you.
And just to add, so currently here at Mayo Clinic, we, as Dr. Kara was just saying, we're keenly aware of this being an issue. So I'm currently working with our patient experience department to come up with a welcome packet for patients that could either be given hard copy or those that have the internet or the portal, we could send it that way. But it is, it's being worked on right now, and it's going to really focus on these types of things, like knowing your care team and what exactly each person on that care team can contribute to your care. So I'm really excited about that. Also, I just wanted to add, also, you could probably, where you check in, the people that you check in with, you could also present this information and just say, I'm a new patient, or I've just heard about patient navigation, I've just heard about social work, these are things that I'm really interested in knowing more about. Do we provide that here at your location? And, just share what you're looking for. I think that would be another good contact in addition to your provider.
Thank you. Do you want to take one more online and then go
Sure.
back to the room?
Yep, that would be great. So this question says, can you address whether there is a way to lower inflammation in the body, meaning through diet, exercise, supplements, probiotics, etc.? Many of us hear regularly that ongoing general inflammation can be detrimental to us. What are some things to do?
Sure, that's such a great question. Well, first, since we're talking about other team members, we actually have an integrative oncology team here, where there's actually a physician who's trained in integrative oncology, and we just started an integrative oncology fellowship, so we can have more people who are experts in that question. But at least in the diseases I treat, there's a lot of research, looking at, for example, exercise, having a role in decreasing some of the inflammatory markers that drive disease. And so we actually are opening a study, this is limited to only certain cancers, looking at how exercise augments the benefits from disease-directed therapies like chemotherapy. So that's something, as Dr. Kara had mentioned, you can control. There are other studies, and so a lot of it will depend on talking to your doctor about this, but at least, like, for example, in the lymphoma world, green tea extract is a substance that has been shown to decrease some of the lymphoma proliferation, and we also had some research on vitamin D deficiency worsening outcomes as well, although that might look different depending on if it's aplastic anemia or MDS. So it really would have to be a conversation with your doctor.
And I would just add to, ask if there is a dietitian where you are. We know that our food, what we put in is kind of what we put out in our bodies. Same with stress too, right? Like, too much stress can be negative for you as well. And same with sometimes the things that you eat. But I think typically when I work with providers here at Mayo, how it is like, okay, we know that what you intake is something that you can control. So a lot of people will say, you know what, I want to be on a specific diet because maybe I feel better on it, or it is something that I can control. And so working with your provider to make sure whatever you're doing isn't detrimental. I think most providers are pretty supportive as far as working with you so that you do feel like what you're doing is, and it potentially is making a difference as far as your overall health. But I don't know that we have like a specific diet that we would recommend that's going to help everything. But I think it all does have an influence, and that certainly is something that is within your control to modify or change when working with your healthcare team.
Great, thank you. Any more questions in the room? Okay.
We have another question online, so I'm going to add a little bit to this. So the question says, is there a right time in the treatment process when it's too late to get a second opinion regarding transplant? So I'd like to add that about a second opinion. Other than you get a medical opinion, what are some of the other benefits for patients of getting a second opinion in the process? Like, what other types of things are very helpful beyond you get a medical opinion for yourself and the reassurance?
So I can start, and then maybe I'll have you chime in, Mazie. Yeah, I do think that there's, there's always a good time to seek a second opinion because it can help not just in tailoring your medical aspects of the care, but also bring in some of these other aspects of management, including, ancillary services. Like I said, we have a physical activity study, we have a digital storytelling video study. So there are things that we here at our transplant center, in addition to the clinical trials for medication side of things, are doing for the psychosocial side of things. So if you seek a second opinion, you may be able to get a little bit more all-rounded care, in addition to obviously whatever is the state of science medical care. So from that standpoint, I do encourage second opinions at any point of time in the journey, whatever the patient is undergoing. Anything else you would like to add?
I was going to say, I've actually seen second opinions after transplants, and sometimes the survivorship care plan's a little bit spotty. So I've been able to assist in that way, to say like, oh, well, maybe we should consider this for your monitoring long-term. And so I think, even after the fact, if you are a little bit nervous about how to live as a survivor, then that would be one way to help, have a clearer plan that's more holistic.
And I just want to speak to the emotional impact of getting a second opinion, because I have had patients tell me, I don't want to hurt my doctor's feelings, or I'm really worried they're going to think I don't trust them. If you have a good provider, they are not going to be offended, or their feelings are not going to be hurt. In fact, they might be glad that you're advocating for yourself and that they maybe can have collaboration with another provider on your care. They work with other providers all the time at other places. So if your provider is angry with you because you got a second opinion, you might need a different doctor anyway. But I don't say that lightly, like it's easy for us to say, yes, get a second opinion, but we know that there's emotional aspects of that as well. And also, I just spoke with somebody yesterday who is pretty confident in her plan, but she's still seeking another opinion just to quiet her mind. And just to say, you know what, I have sought every option available, and this still is the right choice for me. And that I know will bring, she is so nervous, even though she very much trusts her team, but I know that she'll just breathe a sigh of relief, knowing that she has done her due diligence in talking to other people. So we know that practically it makes sense, and hopefully with your insurance it makes sense too, but we do know that there is an emotional impact of that too, and especially when transplant is required or being suggested, that's a huge decision to make. And I think people should be aware of what does that look like if I don't go that route, and what does it look like if I do. I don't think any of us, we've all helped people through transplant, so we can say what our experience has been helping people, but I've not been through a transplant myself, and it's different for every person. So having that gathering information, I think, is always helpful. It can be overwhelming, but that's when you get the information and then you distill it with people that you trust, either outside of your care team or with your care team, that you can hopefully then feel more emotionally confident in moving forward, whatever that treatment plan looks like, and have the support of your team, whether you choose a transplant or not, or other treatment.
All right, looks like we are done with the questions, and so I would like to thank you all for coming. I know it was a little bit of a long day, but I hope you were able to get some good information, and so please keep in touch if you do have questions that come up that you feel any of us can help. I'm sure Lee will be able to, through AAMDS-IF, they will be able to connect you with the appropriate specialist if you do have any questions that come up later. Okay, thank you so much for coming.
Thank you so much, Dr. Tsang, Melody, and Jodi, for sharing your time and your expertise with all of us today. The session will be available later today on the conference platform within the next hour, so you can access this session. Just click on replay, and you'll be able to watch the session. It'll also be available on our website in a few business days. If you have any additional questions, send it to us in 3 ways. To our help account at help@aamds.org. Give us a call at 800-747-2820, or you can submit your question to our Facebook page. We hope that you found the conference very helpful and enjoyed connecting with other patients and families today. We really do appreciate you spending your Saturday with all of us. On behalf of the foundation, I want to thank you again for making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 40 years. This concludes the conference.